Hello, everybody. I want to wish you all a happy Easter. If you guys could see and hear me, give me a thumbs up. That way I know we're good to go. Or send me a message. Oops. I'm not sure why that's going on. Give me 1 second. I want to wish you all a happy Easter. If you guys could see and hear me, give me a thumbs up. That way I know we're good to go. Hello, everybody. Or send me a message. Happy Easter. If you guys can see why that's going on. Give me 1 second. All right, so we're good to go. Everybody's able to hear me. Again, I want to wish you all a happy Easter. Hope you guys are spending a good time with your family and your close friends and relatives. Unfortunately, this year's Easter is a little bit different than before, but let's appreciate what we do have and spend whatever time we have with the people that we're with. Hopefully, you guys are not socializing and spending it with your extended family. Part of the reason why I wanted to do this live stream is some of you guys have had questions that you might want to have addressed, and I'll do the best of my abilities to address as many and be able to answer as many questions as I can. Let me turn something on, that way I can see your comments as you guys are asking them. Give me 1 second. Okay. All right. So if you guys have any questions, I'll start answering them, and I want to welcome you all to the live stream. Most of this is meant to be able to answer your questions. So feel free to ask anything that you guys have, and I'll be more than happy to answer to the best of my abilities. The other thing that I wanted to do was talk about the two different testing modalities that have been developed. Hello, Mr. Kylie. Nice to see you. It's been a long time and definitely miss you. Hope you're doing well and staying safe. Everybody misses you from that class, so appreciate you joining us. And also to my high school classmates that I see most of you guys are on here. It looks like it's a small gathering. So the other thing that I wanted to talk about are the two different testing modalities that we're using to test for the coronavirus, and what each one of them offers, and how we're going to be able to use these testing to slowly get people back to working and quote unquote our normal lives. So before I do that, if you guys have any specific questions that you want me to address, please let me know. And if not, I'll go ahead and get started. Let me check to see if there's any specific questions that anybody might have. Looks like there isn't anything yet. So let me get started on that. And let's see. How will antibodies tests be administered? That's one question I will be answering. And how's the weather there? And will you show all of your amazing view from? Okay, maybe not that one. I'll do that on another time. Okay, so there are two different kinds of tests that we're doing to test for the coronavirus, right? And each of these are done in a slightly different way, and they tell us a different kind of information, okay? So let's start off with the very first one that's developed. This is called PCR testing. So let's see how this test works and why the information that it offers is different than the serological tests that are now being developed and administered. So the first one, PCR testing, is when you go to your physician's office, they swab a little bit inside your nose. And what they do is they then take that swab and they look for the virus. Now, how does this work? So the virus contains a genetic material. This genetic material is called RNA. The virus uses RNA to replicate itself, to make the proteins and the machinery to be able to replicate and do its thing, right? So when we take a swab, and measure within the swab, what we're actually doing is testing for this genetic material. And the way we test it is we take the swab and then we isolate the genetic material through a process. And then we take that genetic material, in this case, the RNA, and we amplify it using what's called polymerase chain reaction. So if the virus has, let's say, 1 or 2 or 3, 10 copies of its genetic material, by amplifying it, we bring the signal up so that we could detect that the virus genetic material is present within your nostrils and within the body, right? So this type of testing tests for the genetic content of the virus. Now, what does this mean? It means that if you come out positive for this, that the virus is present within the individual. The shortcomings of this test is that it's good for about 7 days after symptom onset. So if we were to test it after 7 days, we're going to get some false negatives. Also, initially, when the virus first infects, it takes time for the virus to replicate itself so that the genetic content becomes large enough for us to be able to detect it. Therefore, within the first 3 to 7 days, we have a sensitivity of about 70%. In other words, if you were to test somebody whose symptoms started within 3 to 7 days, on average, we're able to detect 70% of those people that are positive. Now, the other caveat to this, and it kind of leads into some of the stories that I've been reading and people have been asking me, is that, well, can people become reinfected, right? Now, remember, when we're using this PCR technique, all we're doing is testing for a genetic material that's specific to the virus. So even if the virus has been cleared, everything is out of the body, you may still have pieces of this genetic material left inside of you. This doesn't mean the virus is still there, right? All it means is that we're able to detect the genetic material that the virus had. So therefore, this kind of testing tells us some information, but doesn't give us a full picture. Moreover, there could be people who had been exposed, cleared the virus, so you don't have any more genetic material left. So how do we know that these people were once infected and cleared the virus, right? Because if the virus is cleared, there's no genetic material for us to look for, right? So this is where the other important testing strategy comes in. And this is the antibody testing. The antibody testing is done using a serological test. So what happens in an antibody testing, again, this is different than testing for the genetic material of the virus. In the antibody testing, when you first become exposed to the virus, your body starts to form what are called antibodies. These are proteins that the body uses to fight against the infection, right? So what happens is initially you have what are called IgM antibodies. These are the specific kinds of antibodies that are formed in the initial exposure to the virus. And once you become exposed and the body builds an immune response, we shift from forming an IgM antibody to what are called IgG antibodies, right? The IgGs are much more potent and are stronger and longer-lived antibodies. So it takes time for the body to start making these antibodies. It takes about 10 to 14 days after you've been exposed to the virus for you to build enough antibodies for us to be able to detect it. So in this kind of a test, we could test whether the person was exposed to a virus and cleared it, or whether the person is currently still positive for the virus. Because remember, the IgM tells us that I'm still making memory against the virus, and the IgG is telling me I had been exposed to it, and now I've cleared it, and now I have IgG antibodies just in case I become reinfected. So remember, there are two kinds of tests. The first one, we test for the genetic material of the virus. And for that, we have about a 3 to 7 day window period, which will be accurate enough for us to say, okay, the person currently has the virus. Then comes the antibody testing, which we can use to test whether you're currently still fighting the virus using the IgM antibody levels. And then there's the IgG, which says the person has been exposed to the virus and has cleared it. So using these three testing modalities together, we could get a picture, a snapshot of what is going on in the population. Because there are some individuals who are not symptomatic, which means they're not showing the symptoms of the infection, but they could have the virus, right? So those individuals, we could test it with PCR and see if they're currently infected, or we could test them using serological tests to see if they've been exposed and cleared the virus, right? Now, what does this mean in terms of restarting the economy, going back to work? What we need is for the CDC and the government to get a picture of how many people have been exposed and cleared the virus, to get an idea of what is the exposure level in the population. If we've developed significant amount of resistance against the virus, in other words, there is enough people in the population that have been exposed and cleared it and are now safe to go back to work, we could start in a slow progress to let these people go back to do their whatever jobs that they were doing. So the serological tests that are currently ongoing is what will help us to start reinitiating the economy and getting people back to work and continuing to go back to our normal lives. Okay, so if you guys have any questions with that, I'm going to look at the comment section and see if there are any questions before I can continue. Will immune support supplements aid an average healthy individual build additional? Okay, I'll get into those specifics, but if you guys have any questions regarding the antibody and the PCR testing, I want to answer that really quickly before I want to go into that. Post-quarantine life, will there be a modified lifestyle guideline? Okay, so I'll start out with Mr. Kiley's question and then kind of work my way up. Will there be a scenario for just quarantine life, or will there be modified lifestyle? I think depending on how much what we call herd immunity we've acquired, which means what percent of the population has been exposed and has cleared the virus, our guidelines will change. Now, the things that will not change, and I think it's important to continue doing, is our ability to wash our hands, make sure that if we develop symptoms to stay at home, and also distance ourselves from those that are sick. And if you're sick yourself, to do everything possible to not get others exposed. But my guess is that once we've developed a vaccine, we will be able to go back to our normal lifestyle. But I think some of the guidelines that we currently have are important to continue maintaining in terms of proper hygiene, so that we don't get not just the coronavirus, but other kinds of viruses and bacteria as well. But in the meantime, until we have a full vaccine development, we will have to wait for the serological test to see how extensive our immunity is in the general population before we could start to sort of unscrew these tight guidelines and slowly transition back to normal life. Hopefully that answered your questions. Phil, welcome. What is an antibody? I know you know that really well, but just for the general audience, an antibody is a specific kind of a protein that your immune system produces to fight all kinds of infection. It is structurally, it looks like a Y, right? If you think about it, it looks like a Y. And what that does is that antibody that's specific to each of the different viruses or bacteria or whatever, it'll go and essentially attach to the bacteria or the virus. Let's say in this case, this is the virus. The antibody will attach to it and help it clear it out of your system. So your body is continuously producing these antibodies against various different kinds of infections. And moreover, once you're exposed to an infection, you build these antibodies, and the immune system has a way to remember which antibodies to continue producing, so that next time when you're exposed to the same virus, it's able to attack it much faster and stronger and clear it out of the system. How accurate are those tests as they stand now? The accuracy and the specificity and sensitivity will be something that we can answer once we've tested enough people in the population. But based on the current limited studies, it seems to be fairly accurate. And again, they're measuring something that's very specific. And we will be using not just that as a standalone test, but along with the symptomology, the PCR test, and the serology together will give us a picture of what it is going on in the population. So individually, they have pretty good sensitivities and accuracy, but once we put all of that information together, we will have a better picture of what is going on in the population. Hopefully that answered your questions, Mr. Kiley. So again, I will be posting these questions up on the screen so that people have an idea of what the question was when I answer them. All right, let's see. What's the other question? Will immune support supplements, let's look at this one. Will immune support supplements aid an average healthy individual build additional resistance to either contracting the virus or better chance to fight them? If you're a healthy, good question, Anna, and we're getting these kinds of questions all the time. If you're a healthy individual without any pre-existing conditions, in other words, you don't have any heart problem, you don't have diabetes, you don't have high cholesterol, you don't have any lung issues like COPD or asthma, your body and immune system is healthy enough to fight any kinds of infections. So they're adding any immune supplements or boosters doesn't provide you any extra benefit. Now, the only one, and I'm going to say this very cautiously, then don't take this as a full sort of hardcore fact, but vitamin C has been shown to have some protective role against a coronavirus, but that has been tested in the very sick ICU setting where vitamin C supplementation in people who have sepsis seems to help. But in the general public, if you're healthy, everything is good, having the additional vitamin C or any other vitamins or supplements doesn't give you any added or benefit. Especially when you're young and healthy, chances are you'll be able to clear the virus without a problem. Okay, let me check on the Facebook to see if there are any other questions. Let's see. Any updates on passing the universal law for DNR? Any movement on that, or still discussion mode? So what Christina was asking, and I will put this up on the screen to see. Here it is. Any updates on passing the universal law for DNR and any movement on that or still in discussion mode? So what she's referring to is that there were certain hospitals and certain institutes. This is before, it was before when we thought that we will not be able to flatten the curve and we will be essentially limited on our hospital situations. And what some people had discussed is if patients who are coming in and are testing positive for coronavirus, and if by some unfortunate luck their heart stops, do we perform resuscitation on these individuals? And certain hospitals were suggesting that because the cost benefit ratio, as bad as that sounds, and I know it hurts me to say that, but what they were saying is that the exposure that it will have to the physicians that are doing the CPR and the ability to recover these patients is low, that maybe when you are a coronavirus positive patient, the doctors should elect to stop doing CPR on those individuals altogether, even if the person has all of the paperwork that says, please perform CPR on me when my heart stops. Now, this was something that was discussed before we knew what the situation would be in terms of the peak. But right now, all of those discussions have essentially subsided because we were able to flatten the curve. I want to congratulate everybody who helped in that. All of you guys who stayed home, washed your hands, did everything that you were asked to do. And for that, thumbs up to everybody. And that allowed for the healthcare workers to be able to manage the pandemic. And now in most of the states, we're being able to handle the patient load. So all of these discussions about universal DNR and all of the ethical dilemmas that we thought we would face, just like in Italy, has essentially subsided, and we are in a better shape than we initially had thought. Now, in conjunction with that, I also wanted to kind of remind you all that because of your great efforts and the social changes that we were able to follow, we are doing a lot better than the projected models. Now, people are going to say, you guys, you scientists, you biostatisticians, epidemiologists, don't know what the hell you were talking about when you said we're going to have so many million people infected, so many 100,000 people dying. And here we are, we're sitting, again, anybody who dies, even if the number is anything greater than 0, it's bad. I get it. And anybody who says the number of deaths that's above 0 is still good, it's bad. But looking at it from the silver lining point of view, we have done a great job to minimize the number of deaths, okay? And the projections that we initially had were based on the numbers and the calculations based on what we were seeing in China and Italy. But because Americans and every single one of you was able to do what was asked for you, those projections fell very short, right? In other words, we thought we were going to have a lot more people sick, hospitalized, and dying than what is currently the case, which is great. Who wouldn't want to be wrong about such kinds of projections, right? And I hope we still continue to be wrong and the numbers become lower and lower. I mean, imagine if we were wrong in the other direction. That would be really, really bad. But again, I want to reiterate that it wasn't that the models were wrong. The models are something that's continuously evolving as newer and newer data comes in, as people's behavior changes and people are able to do the right things. So the models are not a set in stone answer. It's an ever evolving thing. So therefore things are going to change as newer data comes in. Let's see, how accurate are those? If you guys have any other questions, let me see. I'm going to check the Facebook feed. Are coronavirus patients going through sepsis? Are coronavirus patients going through sepsis? Very good. Coronavirus patients can have sepsis because sepsis is something that you develop from any kind of overt immune reaction towards any kind of pathogen, whether that's a virus or whether that's a bacteria. And the thing is that when the virus infects your lungs, what happens is that it starts to damage along a lot of the lung epithelial cells or the linings of the lung. So that causes you not only to have poor ability to exchange oxygen for carbon dioxide, but because of the lining that is damaged, you become more exposed to bacterial infections. So this is why a lot of the patients develop an overlying pneumonia, right? And this pneumonia is also a consideration when treating these patients. So yes, the patients can develop sepsis either through the viral infection itself or as a consequence of the overlying pneumonia. And this brings me to my other point. When people are asking me, well, Jack, you always tell us if you have a viral infection, you shouldn't be taking antibiotics. And now I'm hearing azithromycin and Z-Pak being prescribed to COVID patients. What have you been telling me? Is this the wrong information? No, no, no. Antibiotics are still used against bacterial infections also. But the reason we treat COVID patients with antibiotics is because they could have overlying pneumonia as a secondary consequence of the ongoing viral infection. And so as a result, we need to treat not just the virus, right, but the bacterial infection that's overlying it. So this is why we give them Z-Pak or azithromycin in most cases to help treat the overlying or the underlying bacterial infection. Okay, let's see. I'm gonna check the comment section to see if there are any other questions. Um, is the coronavirus, let me see, is the coronavirus causing the death, or is virus causing failure in other organs and hence leading to death? Very good question again, Christina. So I'll go through the pathophysiology of the actual disease just really briefly, and I'm going to try to keep this as simple as possible. But the way what happens is that right now there's a theory that the disease is actually two stages. The first stage is where the virus actually infects the body and causes all of those detrimental things that I talk about. Essentially, it infects the lung, and the epithelial cells, which are the cells and the lining of the lungs, starts to be destroyed. And that could lead to multiple problems. One of the problems is that the virus specifically attacks what are called type 2 pneumocytes. These cells in the lung provide a crucial substance. This is surfactant. Surfactant is required to keep the tension, the surface tension inside the alveoli, which are the sacs of tissue that allow for oxygen exchange to happen. So what happens is if we imagine this being the alveoli, when you take a deep breath in, right, the alveoli opens up. And then when you exhale, the alveoli closes. Now, we don't want this alveoli to close completely, because if it closes completely, it'll get stuck, so that the next time you take a breath in, you're not able to open this, and you have to exert more effort to open this. This is why the body produces surfactant. And what surfactant does is that it decreases the surface tension, so that when you exhale, the alveoli are not closing completely all the way through. So when you inhale, it's able to open. But what happens is that the virus attacks the specific cells that are making this surfactant. So what happens is that the person exhales, but when they try to inhale, they have to use much more effort to open these alveoli, right? So this is one of the problems causing the lungs to become essentially damaged. Now, this is the initial sort of cascade of events that happens. And when these alveoli cells become damaged, they start causing an immune reaction. Your body starts to attack and essentially try to minimize this damage, which eventually leads to an overt immune reaction. This is the second phase of the disease. And this second phase is essentially your body trying to fight the disease. And this is what could lead to systemic organ failure, because what happens is when you can't oxygenate properly, you're not getting oxygen going through multiple organs that are critical to keep you alive, including the kidneys, including the heart and including the brain. And as a consequence of this hypoxia, which means low oxygen in your bloodstream, the tissues are not getting perfused properly, and you could have multi-organ failure. And this is what will eventually kill some of the patients in conjunction with the inability to properly oxygenate yourself and breathe. And this is one of the reasons why we put patients who are severe stages of what's called acute respiratory distress syndrome in intubation. We intubate these people because when we intubate, what we do is when the person exhales and these alveoli, because they don't have surfactant, they're going to collapse and stick to one another. So when we intubate people, what we do is when the person exhales, we provide a little bit of pressure into the alveoli so that it prevents it from collapsing completely. And this is why the intubation helps the people that are suffering from this disease. So very good question. Are children being included in studies in equal ratios as adults? Sylvia, I need you to clarify that question for me. And by that, I mean, do you mean are children being used in the studies for medication development, or do you mean are the numbers and the statistics that we're doing include children? Because right now the data says that the children that are healthy with no pre-existing conditions are doing really well. And so far, we haven't had any deaths, at least to my knowledge, of any children who have a normal immune system, are generally healthy, to that have died. So, and in terms of drug development, the children are not included in any of these studies because they do generally well, and we haven't needed any kind of medication intervention in the children. And in general, medications are not directly tested in children unless they've been tested in adults first. But good question. Let's see. Anna is asking, there are some conflicting discussions on social media with regards to CDC guidelines on reporting patient cause of death when COVID is suspected or coupled with other conditions. Some of the guidelines particularly instruct physicians to note COVID as the cause of death. This is a very, again, so the main point of this question is that how do we define death due to COVID-19, right? If somebody comes in, let's say, I'll give you the very extreme example. Somebody comes in and was involved in a car accident and now is bleeding in their brain, and we happen to test them for COVID, and they turn out to be COVID positive. Do we say that that person died from COVID, or did that person die from the car accident, right? Or do we include that death both as a COVID death and a car accident? Again, that was an extreme example, but what if somebody comes in who already had an underlying heart condition and they suffered a heart attack and we tested them for COVID and now they're positive for COVID? Did the COVID cause the heart attack? Did the person die from heart attack or COVID? So these are very tricky questions, and it depends on how each doctor wants to define it. And the numbers will generally be different, but what is true is that we're given, let's say that each person who comes in with some kind of death, we call it a COVID death. Those numbers will still underestimate the total number of deaths because there are going to be a lot of people who won't present to the hospital and die, let's say, from something at home, which will never test for COVID, and chances are they might have actually died from COVID. So eventually, I think once we've had enough people tested and enough people unfortunately have passed away, we should see all of this kind of even out, and we'll get a better idea of the total number. And again, I don't think we should focus on numbers, specifically on the total number of deaths, but focus on preventing further deaths, because people who have died And at the end of the day, what really doesn't matter, the total number that have died. It's just a statistic for epidemiologists and scientists to debate. But from a population point of view, as long as we could bring that number to as low as possible and continue doing our social guidelines to prevent more spread and more death, I think we should be focusing more on that. Therefore, what I call the Corona Olympics, to be sarcastic, the deaths that the media is showing, I don't see the benefit of that. And to be honest with you, I don't know what good comes out of telling people how many people are dying each day from the coronavirus. I think people already understand to a certain degree the seriousness of this and the things that they have to do. Reminding them of the death total every day, I think, only adds to the anxiety and the depression that most people are potentially feeling at this point. So let's try to focus on the positives, which is we're doing the right thing. We're continuing to flatten the curve. We're allowing the healthcare professionals the ability to do their job without overloading the healthcare system. So let's continue doing those and maintaining those measures. And once the serological tests have been done on enough people, we can then start to, in a progressive rollout matter, to let life go back to normal. And let's hope that the vaccine developments will happen and we'll be able to have a vaccine. That way we could prevent the second or third potential spikes that will come out in the future. Okay, let's see. Depends on the, all right, let's see. Are any who have had TB shots? Let's see. Are any recent development on those who have had their TB shots and have survived the infection? Any news? So again, the BCG vaccine is a vaccine that was given to many people and is still being used in certain parts of the world to prevent TB infections. And epidemiological studies had showed that those countries who continue to do TB testing, to administration, they are doing generally well in terms of controlling the vaccine, the coronavirus infections. So they're thinking that the vaccination with BCG is helping fight the vaccine. Exactly how this is done and mechanistically from an immunologist point of view, we still don't have an idea. But it was good enough evidence that in Australia they started a clinical trial to use the BCG as a sort of a stopgap vaccination modality until we're able to develop a corona-specific virus vaccine. Now, is there new news from that? Not that I know of, but the clinical trials are ongoing, and I will update you guys and let you know as soon as there are any developments in that front. But good question. Let's see. I'm gonna check Facebook to see if there are any other questions in regards to that. If not, I will maybe let you guys go to your Easter and enjoy it with your family and your friends, either virtually or in person. So I think I've answered generally most of your questions. I will wait another couple of minutes if you guys have any other specific questions. But really, the point of today's live stream was to talk about the two different kinds of modalities of testing. And I think it's important to understand what they're doing, right? What each one of them is testing, because you'll be hearing this on the news all the time. Dr. Fauci will be talking about this. About the different types of testing modalities, and it's a good idea to see where they're coming from and what they mean and how we're going to be able to use these to slowly roll out our plan to go back to normal life. And please remember, continue doing the great job that you guys, everybody is doing in terms of staying home, limiting our interactions. washing our hands, and making sure if we're sick, if we don't have the red flag signs, don't go to the hospital. Stay home. You should be able to recover unless you have issues with breathing, you have neurological symptoms, you're seeing your fingers and tips of your hands turning purple, right? Outside of those red flag signs, just stay home and take Tylenol to help with the fever, and you'll be able to do well. And remember, always cough in your elbow, never in your hand. And the last thing I want to say is, if you're wearing masks, please know how to properly take it off, because I've seen some people wearing masks with it hanging off their mouth. Make sure it's covering your nose and your whole mouth. And when you take it off, make sure when you're taking it, you don't touch the front part. This is the part that is exposed to the outside. Take it off from the back and put it inside a Ziploc or a Tupperware container so that you don't expose your hands. And when you're wearing gloves, again, my objection to wearing gloves is that people feel like they're protected and therefore are not as careful, and they'll touch their face, their mouth. If you're wearing gloves, imagine those gloves having jalapenos on them, and you're trying to use it to put your contact lenses on, right? You don't want to put a jalapeno head into your contact lens, right? That's going to burn. Imagine your hands being jalapeno covered hands. Never bring it close to your eye, mouth, or your nose, okay? Even if you like spicy stuff. That was an analogy, okay? So please do not touch your hand to your face, mouth, even if you're wearing gloves. Take them off, wash your hands, and stay clean, all right? Thank you, Mr. Kiley. I've learned from the best, so I truly appreciate it. Well, with that, I want to thank you all for joining. Hopefully this has been a learning session for you all. And again, feel free to ask me any questions and I'll try to answer them to the best of my abilities. Messenger, Facebook, anything. And I will try to do these maybe once a week to kind of gather all the questions that you guys have, and also any important developments that are happening. And if there's major breakthroughs, I'll definitely update you guys. In the meantime, I want to wish you all a happy rest of your weekend, and enjoy the Easter with your family, and please stay healthy, do the right things, and with that, God bless you guys all, and I will see you guys in the future. Take care.